Helen Golightly, Chief Executive of the North East Local Enterprise Partnership, which, for those of you who are unfamiliar with us, is the economic development agency for the region, running from the Scottish borders to Teesside, from Cumbria to the coast. You can find out more about what we do on our website at www.nelep.co.uk. At the start of the COVID-19 pandemic, we set up the North East Economic COVID-19 Response Group, working with leaders across the region representing the two combined authorities, businesses, universities and transport, looking at the impact and recovery planning for the region. We set out a 5-point plan based on the 5 themes of supporting businesses, keeping people in employment, working innovatively to solve challenges and problems, planning for recovery and coordinating the region's economic voice. There's no doubt that COVID-19 presents some real challenges for our regional economy, but for the digital sector, there is of course a myriad of opportunities too. Amongst this time of disruption, and as we move towards planning the long-term recovery for the region, there is an opportunity to build on the momentum generated by COVID, where we have seen years' worth of digital adoption compressed into a matter of weeks. The North East tech sector is leading the way in adopting and adapting new ways of working. As a region, we host a creative and responsive tech community that embodies the entrepreneurial mindset. We are watching our most innovative companies pivot to create new products, services, solutions and markets, and those businesses are influencing other sectors to do the same. We now want to build on the ingenuity and creativity that businesses have shown to rapidly pivot and change their operations. And we are working collaboratively to support these businesses to thrive above and beyond the pandemic. We want to create a new generation of scale-up businesses driven by digitally enabled business models and to level up the North East using the adoption of digital technology to drive productivity and growth. Whilst there are opportunities, we also have to acknowledge the challenges we still face. Although we have a strong tech sector, not enough of the technology and applications that have enabled such rapid transformation have been developed in the North East. The challenge for the sector is to fulfil its potential and to develop the next generation of applications that will be adopted by businesses across the globe. Much of this innovation will be driven by working together with non-digital firms, so collaboration is key, as is access to finance. Smaller digital businesses are facing challenges in cash flow and investment, and so mobilising our investment community and regional funds is also vital to ensure continuity. We can offer concrete practical support and opportunities for digital businesses. For early startups, the High Potential Startups programme offers mentoring, training, access to finance and co-founders. The Supply Chain North East programme is on hand to businesses to diversify their customer base and unlock opportunities in new markets. Both of these programmes and details of them can be found on the Growth Hub website at northeastgrowthhub.co.uk. Key to all of this, of course, is partnership and collaboration. Values core to the North East Local Enterprise Partnership and to partnerships like Dynamo. Together we can create the conditions to enable the digital economy to flourish, to equip the region with resilience to meet the challenges ahead and to lead the way in digital transformation across all sectors. At a national level, the North East LEP is working with colleagues across government departments and with TechNation, the Digital Catapult and Innovate UK to align central and local opportunities and to ensure the North East leverages investment. We're also working closely with partners to enable our newest dynamic, innovation-led firms to access support from the Future Fund and from Innovate UK's grants announced in the Chancellor's COVID response package. Locally, we recognise and celebrate the diversity of the digital business community, from established corporates to the freshest of tech startups. The ecosystem is varied and vibrant. We know that there are challenges ahead in retaining this, but we look forward to continued collaboration with Dynamo's membership base and together enabling the North East digital economy to be greater than the sum of its parts.
Time to get to grips with our very first panel session, and it's on a subject that wasn't even a thought a couple of months ago, and now it is our reality. Responding to the COVID-19 pandemic. That's the title for today's panel. We're going to focus on the areas which have been at the coalface of this, which are, of course, health and society. No doubt you've been outside your house clapping for carers. You might have spoken to people whose stories have really hit you in the midst of tackling the virus. They might have been working frontline, muffled in PPE. They might have been answering anxious calls about COVID symptoms. They might have been desperately researching a vaccine or taking massive risks for them and their family, taking care of elderly and sick people. These are all frontline jobs in the fight against COVID. Now, to help them do these jobs, a raft of changes had to be brought in. And you'll know this, maybe these were ideas that were just in the pipeline for some time, the idea to do more home working. But generally, these were sudden changes. There were urgent actions that needed to be taken. So we thought we'd have a look at what's been happening behind the scenes. What's the impact been like? How's the North East in particular responded to this? And then, of course, looking forward to what's in store for us. What's our future going to look like as our movements are tracked, infection rates are tracked? There's obviously been a massive change to our air quality during COVID. So a lot to get into here. We're going to hear from 4 very different experiences of how our regions responded. We're going to start with Ian Davison. Ian, could you just tell us what you usually do? And then, of course, how that's probably changed over the past couple of months.
Yeah. I'm Ian Davison. I'm the Business Information Services Director in an NHS organisation called North of England Care Systems Support. I've been in the NHS for 18 years. Prior to that, in the private sector, and the last 7 years of those 18 years has been in NEX, North of England Care System Support. Many people probably don't know who we are in NEX. We're a well-kept secret, I think, in the North East. We are an NHS organisation headquartered in the North East. We employ around 1,300 people. Turnover last year was 90 million. So my portfolio includes data management, business intelligence, digital applications and IT. And I've got a team of about 400 people across the country that provide those services. Focusing on IT, we provide IT to all of the CCGs, the clinical commissioning groups across the North East and in North Yorkshire, York and Derbyshire, about 22,000 users. So sizable set of user base. And across that region is all the GP practices. So we've got 600 or so GP practices that we provide IT services to, and other services like digital applications across the country. And just turning to COVID, when COVID first hit, our level of activity, as you can imagine, went through the roof. We serve GP practices with very much frontline services, and our first priority was shifting practices from very much a face-to-face service, face-to-face seeing patients, to one where it was almost fully distant, remote. So a lot of work setting up practices ready for working remotely via telephone, via video conference. So a major challenge in a short space of time. We then went from there to second stage response around setting up hot hubs. So if patients did need to see a GP, they'd go to specific locations, not their normal GP practice in many cases. We've done a lot of work on information reports, making sure that we've got consistent information across the whole region. All the senior leads across health, we're getting the same information on the position with critical care beds, on staff sickness levels, on infections and deaths. Digital applications, I mentioned earlier on, done a lot of work on modifying our digital applications to support the COVID response. I think it's probably fair to say we've now settled into a new norm.
The new normal. One of the much used words of the moment, together with unprecedented. And what an exhaustive list. This is, we'll get into the details of that in a moment. Working broadly in the same fields, by that I mean health and working with IT systems. Graeme Fletcher, tell us about you and what you were doing and how that's changed.
Yeah, certainly. So I'm Graeme Fletcher. I'm the Chief Information Officer here at Connect Health. Connect Health, for the unfamiliar, is the largest independent provider of musculoskeletal services, which primarily includes physiotherapy with a number of other things. We're a private organisation, but we serve about 350,000 NHS patients every year. We are northeast centred and northeast based, and we have a 30-year history, born and bred up here, but we are geographically spread all over the country. We have a lot of practices down in London. In my role as CIO, my job is to look after all the technology that underpins the business, from infrastructure, telephony, through to clinical systems and everything else. I think we'll touch a little bit more on what that's meant to us from a COVID point of view, but similar to Ian, some let's call it exciting times, as we had to shift an entirely face-to-face office-based business to an entirely remote and non-face-to-face business, and make sure that we kept our patients as safe as we could along with our colleagues.
I like the way you've said exciting times. The word challenges comes up time and time again in the interviews. I'm now going to move to an area which I've been blown away by, actually. I did a BBC interview looking at the NHS Business Services Authority, and I've been looking at how your contact centre staff in Newcastle have just transformed themselves, volunteering pretty much overnight, Lisa, to just work 24/7, doing a whole raft of jobs they never did before, and then doing it from home as well. Can you tell, and just for the sake of the nation, basically, that's why they did it. Can you tell us a little bit about what NHSBSA does and what your role is?
Yeah, sure. So my name's Lisa. So I work for the NHS Business Services Authority, which is an arm's length body of the Department of Health and Social Care. And we provide a range of critical services to different NHS organisations, contractors, and also patients and the public. And you touched on there one of the services that we have stood up a number of contact centre services really quickly to help different NHS colleagues. So the NHS Digital, in terms of the 111 service, as you know, they've obviously received an influx of calls and they needed some support really quickly. And that's the kind of work that we do. So normally, pre-COVID, my role is Head of Digital Services. I've got a team which has rapidly grown over the last 2 years, from 15 people to 150, and still growing. And our team, so I'm responsible for the strategic direction of the digital services, so working in Scrum and developing services. And I've been reflecting over the past 3 months for the COVID challenge, and it has been exciting and challenging, but also, really long hours. And the BSA Services Authority have stood up over 25 different activities supporting the COVID activities. And they range from consultancy, providing payment services, contact centre support, as you mentioned, from service design and delivery of new services. So, and the reflection I have preparing for today and actually thinking about it's been really interesting, because actually, I've been in awe of all my colleagues who've got used to transitioning from working in an office, collaborating, and as you typically see agile organisations working from home. And actually they've done that amazingly, and then also working across government really quickly on these brand new services. So typically we haven't met these people before, and actually within a week we've been deploying software together, which is unheard of, working across organisations that quickly. So we've developed a number of services, and we've sent a lot of the first response. We got engaged to send messages, which was the quickest way to reach out to some of the most vulnerable people in our society, and to advise them about health and guidance about what to do to self-isolate. So we've sent over 13 million messages to people, and that's that's also for those people who are symptomatic and self-isolating, or those vulnerable people in our community, or people who are, you know, receiving their test results. So we've done a lot of different variety of different services within my team. So I've played a different role during this activity, a bit like what Ian mentioned before, which was, you know, going around people looking for hand sanitizer. I've been doing a delivery manager role, and, you know, being there for, as well as supporting the BAU activities that my team still do.
All change, and all change very fast, which is something I think anybody will be nodding their head to at the moment. Professor Phil James, not in health at all in one way, but my goodness, the air quality is something that, you know, that is a whole change for us. Tell us what the Urban Observatory's been up to over the past couple of months.
Well, so many of you might be aware of, you know, Newcastle has this internationally unique facility which we call the Urban Observatory, which deploys sensors in and around the city, and also repurposes data that's captured operationally. And, you know, initially that was for research purposes, so we could understand the sort of rhythms of the city and how things interact at the scale. You know, many people talk about smart cities, and Newcastle is on the road to being really one of them. You know, we collect 7,000 observations every minute of every day across the city, from air quality, transport movements, traffic, pedestrian movements, water quality, and try and get this sort of holistic understanding of what's happening in the city. We've made several £1 million investment in monitoring in the city, and Newcastle is the most observed city of any in the UK, and it has this sort of unique facility. What we've specifically been able to do around COVID is we repurposed a lot of the data that's already there. Obviously, this sensors are out there. They talk to communications network. They transmit data back every minute or every second. They're throwing that data back, and it's largely automated. So we were very lucky that our systems continue to provide data. And what we were able to do in consultation with the City Council and Public Health is repurpose some of that data. So we built a dashboard within a couple of days that sort of gave you a bird's eye view onto sort of key metrics as they happen. So how was footfall changing in the city centre in response to policy? How was traffic being affected, and what were the numbers? So provided a sort of quantitative analysis of the city in real time. So as announcements were made, you could actually see the impacts of those in the data minutes, hours later, and you would be able to reflect on those. So that's been our response to COVID. And obviously, as the restrictions have lifted and changes have been made to policy, you can see that playing out in the data in real time.
Wow. We're going to return to that. There's a lot in there, including Newcastle being the most observed city in the UK. That's not in a kind of Big Brother way, is it, Phil?
We work very hard to be exactly the opposite of Big Brother. So everything's open. There's no facial recognition. There's no tracking. There's no things. We do use CCTV and CCTV and machine learning, but only to do counting. So we get numbers. And I think it's really important, you know, it's an important conversation to be had about, you know, privacy and data. But on the other hand, if we don't count things, then they never get put into policy. And we've been counting cars for 40 years. So if we only count cars, you get policies designed for cars. So, you know, there's a balance to be had between privacy and whatever. And we work very hard to not do any sort of identification. It's all sort of just numbers. How many people walked past this point in a 5-minute period type thing. So there's no chance of actually capturing personal or identifiable information.
You'll have counted a lot of new joggers. I mean, really, who are they? Where have they come from? That hour's exercise.
I haven't noticed the joggers, but the cyclists have certainly gone through the roof in terms of numbers.
Yeah, I was talking to a bike shop the other day. Literally can't get your hands on an electric bike, which I feel is a lot of people's, if they had the money and were getting investment from the workplace, they could actually finally go cycling with a motor. Right, I'm going to get into something about data, because there is so much of it, and you guys must have been processing endless streams, endless numbers. I think, Ian, because you mentioned about this new norm, what do you think, with all of the statistics you've got so far and all the people you've been speaking to, what do you think is the new norm, let's say now for the next, it's hard to picture, isn't it, 6 months, say?
So the new norm for us, I guess, is the same for many other people working from home. We're following the national guidance. If you can, continue working from home. We've got about 95% of our staff are working from home, and most of our customers are in a similar position. Extensive use of this kind of scenario, video conferencing. We use Microsoft Teams, but there's many others available. Zoom, GoToMeeting, we're joining all these different variants of these meetings. We've never been so in touch. I see and I speak to people probably more than I do when I'm in the office. It is quite intense though. I'm finding personally, and many other people have said the same thing. So we don't have breaks between these video meetings. We find ourselves sitting in the same chair hour after hour and desperately needing a break between meetings, and we need to learn from that and cut off meetings maybe 5 minutes early to grab a quick break.
I'll make a note. I'm just wondering, before you explore that a bit more, GPs, I mean, what have they said to you? Because for a long time there was a suggestion, a thought that they didn't need to have so many people in surgeries. They didn't need to be doing so many face-to-face appointments. Is that it now? Are we going to just have, say, 5-10% of people going to surgeries and now doing more consultations online?
The GPs will follow a national guidance and national policy. My personal opinion is that, yes, we will see some of this here to stay. It works for many patients. It works for many GPs. GPs like the flexibility and they like the convenience. It's not a substitute for face-to-face. In many, many cases, you do need to see people face-to-face. But in other cases, it does work. It is an efficient way of delivering a service, and particularly now, and I think social distancing is probably here to stay for some months to come. So I expect remote consultations are here for the future as well. We've done a lot of work supporting NHS England in something called total triage, and it's all about learning from the best models across the country to understand how best to triage individuals over the telephone and triage them into different directions. Do they need a face-to-face appointment? Can they work with video consultation? Is telephone sufficient?
Are those appointments quicker or longer?
I don't know factually. I have picked up that some appointments are more efficient, quicker. I haven't heard personally from GPs as to whether they have particular difficulty, because of course there's the administration around it, and some patients will be used to the idea of using a telephone, using a smartphone, video conferencing. Other people may struggle with that. So if there's an efficiency factor from quicker appointments, I suspect some of it's taken up by challenges associated with technology in some cases.
Graeme, your world, how on earth do you do physio virtually?
A significant part of what we do is that consultation and triage, and we've been operating on a telephone triage basis for quite a while, so that's already been in place. So we've kind of basically extended that to allow for video consultation as well. And what the guys do is basically talk through the patient about their conditions and kind of assess where they're at. We've already got the facility to then deploy exercise plans electronically. We'd had all of that already. So it just gives us a different medium to work through that. I think clearly that there are some things which, we will need to get back to a more face-to-face model where the contact is necessary. But clearly at this point, that's quite a long way off. We will retain what we're doing now in a permanent feature. We will not do this anymore. We've been looking at, video consultations and triage for quite a while. So we'll just work through a slightly more blended model, and the numbers will vary depending on demand. And it's been quite successful. I mean, we have a different, one of the key things that's a success for us is around our, we have some chronic pain services that are an adjunct to what we do. And with some of that, can also come some fairly significant mental health conditions. But we're finding that some of those patients, because they don't have to, move, they don't have to go to an actual location, the geography sort of helps because they don't have to go anywhere. And they're more comfortable kind of opening up into this scenario than they were sitting right in front of a clinician. So we're finding some services are kind of better for the patients, which we probably hadn't thought of beforehand. Volumes are down because obviously the focus of the entire sort of NHS machine is being more on the broader COVID. But yeah, we've managed to make that work quite successfully, really.
Coming out of lockdown, there'll be an awful lot of people with a few stretched hamstrings to sort out, I imagine. I'm just wondering, the osteopaths, the rheumatologists, do you think that as the time's gone on, they've had to continually adjust? So initially thinking, right, we'll do these virtual consultations, this is going to be purely temporary, we can keep this going for so long. And now there is this mental adjustment that pretty much all of us are having to make, which is some parts of this are going to stay forever. My job has changed forever. And there's a risk that if the technology doesn't move with it and adapt with it in that same way, it's not really the job they chose to do.
I think as a profession, because as I say, we'd operated quite a number of kind of remote services, albeit they were office-based, they were remote. We had a number of the population were already getting used to doing it that way. I think it's changed, what people perceive the job to be in a lot of cases, that return back to normal and going back into face-to-face brings lots of other things with it, the getting back. We have a lot of guys in London, so an awful lot of people getting on the tubes and fighting their way through to the different locations. Whether it's, say, from a COVID point of view is part of that thought, just going back through that commute and all of those different considerations is going to be interesting. But I think, there is still an optimism that everything we do will return to a sense of a bit more face-to-face, and that is not unique to health or anything else. If we thought that would never be the case ever again, then I think, a lot of people in jobs across the country would probably think differently as well. So not unique to our profession.
Lisa, the move to home working was something that's happened so dramatically, almost overnight in some of your areas with the NHSBSA. Office blocks being emptied, a handful of people being put in there, socially distanced, and others having to work from home. Do you think that will stay, or do you think they'll come back into those environments?
I think they'll end up being a blend, and having the technology and tools available is really helping to collaborate and work together. So there's lots of different tools that we can use that can mimic some of the behaviours and ways of working that you do in the office.
How did you make the change so quickly? You mobilised everybody in a way that was so urgent. I mean, you've mentioned the NHS 111 service. I mean, this stuff couldn't wait. Yeah.
So I think, and I did a lot of thinking around this, and actually I think it's because we've got a really great framework in place of working. So everybody knows the processes and ways of working and their roles. And what I think mobilised quickly, we work flexibly, so people could work from home as much as they wanted. So in the digital team, we're all set up and geared up to work from home. So when we started to work from home, when lockdown started, it was establishing the new norm, but then to mobilise the teams really quickly. And my thoughts were around, actually, are people okay? So there's a sense of responsibility for people in checking in on those people, but then standing up the services as well at pace. Like, how do we do that? So there was a lot of discussions, and I think other people have mentioned about collaborating more, and actually you do make a conscious effort to collaborate more. So over the different tools, I guess that I'm finding a lot of the conversations and meetings are really to the point, and you get to the point that you want to discuss much quicker. So actually there's an efficiency there as well.
I I've noticed that. And I think I'm going to bring Phil in on this because, you know, you're working with government departments, you're working with what would have been a lot of red tape, I imagine, at times. Do you feel that's just been stripped away? You know, suddenly things that would have taken ages to get sorted before can be done?
When the short answer is yes. And I think moving forward, there's going to be enormous opportunity from a research community looking at many of these data sets, particularly when you start thinking about the NHS data sets that are being collected and 111, those sorts of things. And, you know, we have this enormous opportunity, although in terrible circumstances, to really answer some very hard questions. They may be things around stuff like air quality. We've run an enormous social experiment that says what happens to the air quality when we take 50% of the traffic out. And now I can tell you, you know, our NO2 emissions fall by 25%. That's what happens when you take out 50% of the vehicles. But it's a complex picture because other indices like PM2.5, which is micro dust, which has been implicated in a whole bunch of health issues, hasn't really been touched at all. Very
Really?
little. Very little.
That is surprising because when I was last in your lab, we were looking at the data connected to that because there was a big concern around schools, and particularly because children are exactly standing at exhaust level and those microparticles can be pumped out. So that hasn't been affected.
Hasn't been, well, I think because there are many other issues to do with climate and wind direction, and because they're dust particles, they exist for longer than gases. So, you know, you probably, we haven't seen a huge reduction in Newcastle. I suspect, and there's some data to back this up, that there has been a national reduction, but, you know, locally we haven't seen it as yet. So I think at the end of the year, we'll be able to look back and say, well, yes, there's been a national reduction, but it hasn't been impacted. We haven't seen the impact region. And I think that's a really interesting point about the regional aspects of this as well, because a lot of, you know, we came out of some of these restrictions have been lifted when perhaps, you know, I'm not an expert, Newcastle and the Northeast regionally wasn't quite ready for them. So having regionally focused data and thinking about things regionally, because lots of different regions things are happening at slightly different times. And I think that's going to be an important thing moving forward about thinking regionally, not just nationally or London centric, and combining data like NHS data with environmental data to ask some new questions.
When you say we weren't ready for it, in what way?
You know, I think that this issue about the scale at which we understand cities and regions, it can't just be a national picture and one size fits all. I think what COVID-19 has shown us is one size doesn't fit all, and there needs to be regional responses, or even, you know, citywide or block-wide responses to some of these.
Ian, you must be talking to national level and different parts regionally. Do you feel that we're talking about collaboration at this conference? Do you think there are things that can be done to improve that? It's been a long-term thing to say, you know, the Northeast's voice isn't being heard in various platforms, but when it's come to COVID, has that been different?
I think we've got a very clear common purpose, a very clear common enemy in COVID. We as an organisation and a lot of the NHS, we try to do so much at once. And a lot of the things that we've been trying to do, we decided in COVID, in that initial peak, actually some of these things we can pause for a while and we can redeploy people and focus on other things. And there's been a lot of collaboration across organisations. I join groups every week. I've got calls with colleagues across primary care, so I speak to GPs and colleagues in CCGs, colleagues in NHS England. We've got a regional digital group which includes mental health and the trusts. I have calls with our opposite number, so there's 5 organisations like mine across the country. We talk regularly. So there is absolutely, as I say, we've upped the game in terms of collaboration across the NHS to all help focus on this common enemy.
Do you talk regularly to the care home sector? Where does that fit in? Because, you know, health and social care is meant to be under one umbrella, but we get continual messaging about it's not.
Yeah.
They're not linked like they should.
We don't personally. It's not an area that we as an organisation get involved in. However, if I talk about briefly one of our digital applications, we put in place this new digital application called the Capacity Tracker, which is all about understanding what a capacity does a care home have that a hospital, so a bed manager in a ward in a hospital has people who are medically fit for discharge and needs to free up a bed, and that person's maybe not fit enough to go home yet, they need some respite care in a care home. This application quite simply matches supply with demand, so I need to find a space, and care homes across the country can use this application as their shop window to say, I've got these beds available. We agreed with NHS England and the local government association that we should adjust that tool so it can capture information in care homes around PPE, around staff sickness, around the number of cases of COVID. And we were asked then to roll that out nationally. So that went from 50% of the care homes across the country prior to COVID to it's more like, last time I heard it was 97% of all care homes are using that now. So it's allowing us to capture really valuable information across the care home sector. But beyond that, there is a lot of conversation around IT support services, for example, into care homes, and how we can improve that and how we can better coordinate and better bring care homes into the wider health and care collaborative approach.
Lisa, we're talking there an awful lot about data, and your guys are processing an awful lot and handling these calls. What was that before? You said about 13 million messages going out. I mean, it's a staggering number. Can you keep that pace?
So,
as COVID peaks go and other things come in, can you keep that level of pace?
Well, I think that's the benefit of actually setting the organisations up to work with cross-government organisations. So we actually utilised GovNotify, which are common components that different organisations can use. So it shows that the benefit of, you know, working across government to, you know, for economies of scale, and quickly integrating with these services to deliver, you know, these services. So they're scalable. So I think now it's demonstrated actually the value and the effort and the investment we've made in technology to deliver these services in the way that we have. You know, I think the learning I'm taking away is actually starting small and iterating and actually, you know, being really clear what the small thing is. Sustainability of the messaging services, the services, the infrastructure that it's built on is, you know, it is scalable, so it can take that pace. What we have done during this is keeping best practice, so carrying out user research to see, and actually is the content and the messaging fit for purpose. And actually during the actual heat of the work, we actually did continue doing best practice and ways of working, and we did do user research, albeit in normal times. We would do that in a private beta controlled environment, but this needed to be live. So we were actually doing research with live people. And then changing the content immediately. So we were doing daily releases of new features and, you know, responding to public and business demands as the political landscape changed. So did the users and the business needs. So we delivered the first lot of the key workers who were tested and what that meant to them about when they could actually return to work. We were providing help and guidance and doing user research with those key workers to say, actually, what do you need? What is worrying you around this? And how can we help? And then I was then sharing that information across all the different projects that were going on across government. So actually we were tractioning and getting so much information and sharing across all the different government organisations, which frankly wouldn't have been possible before COVID. So it was kind of, we've mentioned red tape before, but actually removing the barriers. We've now got a shared communications channel that we're talking, so I'm talking with colleagues daily, you know, about sharing learnings and insight to things that we would never have done before, which actually is helping make services better for the public.
A question for all of you, really. Do you think there's a risk, though, that even though all of these things sound fantastic and my goodness, we're learning so quickly and look how adaptable we are and we can actually do it even if we're big organisations, that as we gradually come out of this, we just go back to doing things the way we've always done because that is human nature to follow habit, and those systems have been in place for so many years that will just continue? Graeme?
I mean, I think there's a risk because, as you say, humans are humans and tend to elastically go back to what they're familiar with. But certainly within Connect, we've been very, very clear in terms of what are all the positives we've taken from this. How can we've managed to do things in 2 weeks that we would have planned to take 6 months in the past, when there's nothing really different. We know we haven't actually done anything tactical. We've just done strategic things quickly. And what I'm doing constantly with my team, and I guess the business, is just, let's keep asking those questions. Why would we do things like the way they were? We haven't actually cut any corners. We've just done things faster. And there wasn't anything in our way. And we just haven't constantly asked those questions about why wouldn't we now, as opposed to why would we? And I think that's
what was stopping you before, Graeme? When you have that conversation, what did people say? What was getting in the way?
I think a lot of it's individuals, in the sense of, maybe as an organisation, everybody thought they needed more permission than they actually did. I've only been here about 18 months, so there's still quite a lot of different things we're trying to do. And I think a lot of that is that, you already had the permission. Nobody was stopping you, and it's about empowerment. It's about, just people feeling really engaged to do the things. Give them a framework so that they don't operate, and kind of breach policy and stuff, but just kind of replay back some of that. And it's given us an opportunity to help shift that mindset a little bit, that nobody was in our way in the first place. We just perhaps thought we needed more permission than we did. So it's difficult. It's really hard to pin it down. But I think in order to stop it going back to the way it was, that is going to be a constant challenge, to just keep asking that questions of, what was stopping us? Why wouldn't we?
I would echo that point as well. And we won't recover back to where we were. We won't continue as we are right now, with most of our people working from home. We've got a recovery program we've put in place, but we've deliberately called it Recovery and Renew. Looking at what have we learned, what can we do differently. We're looking at all of our services and said, well, what have we stopped? Are we going to restart it? Are we going to restart it in a different way? Do we just leave it stopped? Because actually we don't need to continue doing some things. But it's about renew as well as recovery.
Phil?
Yeah, I was just going to say, that there are enormous opportunities. There are a few risks as well. The steers around public transport may mean that we're actually having negative impacts on, we're already back to 70-80% of normal traffic, although the peaks are lower. There's everybody who's going somewhere, when they're going to a garden centre, or this week when they were going to shopping, are doing it by driving rather than public transport. So we may have pre-COVID levels plus some, and how long does it take to recover confidence that people start going back? And the other one that, again, I'm not an expert, but many of us are very fortunate that we can work from home and we can use this technology. And there's a danger as an organization that our organizations, we have to think about inequality. Do we exacerbate inequality because those that can work from home do so, and they have a better work-life balance, potentially they have more flexibility? But there's plenty of people in the service industries, in the hospitality industries, in the NHS, who are going to struggle with that. And I think there may be a bigger debate about inequalities moving forward, because not everybody is in a position to take advantage of these new normals, as we've been calling them.
And Phil, I'm keen to just work out what the impact's going to be for us and our life here in the Northeast. And I feel like you're the man who's going to tell us, with all your information on smart cities. AI, are you using that to address social distancing?
We're not at the moment. We have run some experiments looking at it. but we're certainly, so, you know, if you've been into Newcastle city centre, then you'll have seen the sort of lines painted on the thing, and to try and the directions in which people can walk to try and facilitate those. So we're working with not just Newcastle authorities in trying to help them and provide data to them on the efficacy of these interventions. And, you know, for many years I've been spouting on about it's really important that we have very quick response with data, and real time is important. And to some extent, it's been this has been a realization that sort of very rapid turnaround on data is important. You know, it's no good waiting 6 months and then looking at the data and analyzing it. You know, what's required is almost as it happens, or certainly within a few hours or days, to provide analysis back to help the decision makers understand whether the policies they're doing are correct, where they can be improved, and then having this sort of constant sort of experimentation, which I think others people have touched on here, this ability to keep on constantly changing and adapting in a very fluid way. So I think, you know, there's going to be a lot more of that as we move forward.
Thank you so much to Phil James, Professor Phil James, to Ian Davison, to Lisa Moran, to Graeme Fletcher. We'll talk again. Thank you.